Good evening, everybody. Thank you for joining the Apprentice Benefit Awareness webinar. I'm Cassie, and this is Nicole, and we're communication specialists here at the Fund Office.
Before we get started with our presentation, I just want to show you guys how to go about asking questions during the webinar. If you are viewing this webinar from a desktop device, you can type questions into the box on the right-hand side of your screen where it says type your message. Here, it'll be viewed by the Fund staff and completely invisible to everyone else watching. If you are viewing the webinar from a mobile device like this, you can click the questions bubble in the right-hand corner to bring up the questions screen. Here you can type your message and it will be viewed by the Fund staff. And when you're done, just select the X on the top left-hand corner to bring you back to the live webinar. If for any reason you exit the webinar, don't worry, just select Join Room. And once it loads, Join Room again to bring you back to the live spot at any point. If we don't get to your question for any reason, don't worry. You'll be contacted by a Fund staff member about it later. You can ask questions at any point during the webinar, but they'll be answered at the end during a question and answer period from Fund staff.
With us tonight, after the introduction from me and Nicole, we have Dave Latushko, the collections manager, who will go over an overview of the collections of contributions in the hours department here at the Fund Office. And then we'll bring on Mike Wagner, the medical manager, who will give you an overview of the health and welfare department, your medical benefits. And then Joe Obahowitz, the fund director, will go over the pension, annuity, and savings plan. And then at the end, we'll bring everybody back on for the question and answer period.
Just a quick overview of the important resources and the ways that the Fund staff communicates with you guys. Our website and our mobile app is the one-stop shop. You can view all of your benefit information there and find anything you need. A feature of that is your member dashboard or my profile. Dave will get into this later. We also send out a monthly newsletter with benefit updates and important information. And we are constantly updating our social media channels, so be sure to follow us on Facebook, Instagram, and YouTube.
Since this is an apprentice webinar and some of you guys are new to the union, we just wanted to let you know how the Fund Office functions. The Fund Office is governed by a board of trustees, 6 labor trustees and 6 management trustees, and they develop the plan of benefits. And then the Fund Office manages that plan of benefits through the 3 departments. The collections department, which is your work hours and your employer contributions, and the health and welfare department, your medical benefits, and the retirement department, the pension, annuity, and savings plan. So with that said, I'm going to turn it over to Dave Latushko, and he will go over your collections of contributions.
Thank you, Cassie and Nicole. And I also wanted to say good evening and thank all of you for taking time out of your busy schedules to join us and to learn more about your benefits. Truly, this will be a good move for you and for your families for years to come. We have a very robust benefit package, and the better you know how to utilize them, the better served you will be. My name is David Latushko. I manage the collections department, and I like to say that it's the most important department because everything begins with your hours, with your benefits. If these benefits are collected, you don't have healthcare eligibility. You don't have a pension benefit. So what do we do here at collections? As is stated in the name, we make sure that the contributions come in from signatory employers, from union contractors. We make sure that money goes to the proper funds. We also handle the cafeteria and vacation benefit, and we administer and track all reciprocal hours. If you ever work out of area in a different location and benefits are paid to an outside fund, you fill out a recip form, and we make sure that those hours come back home. We'll get into all of these in a little more detail. This is called the Carpenter's Roadmap. You see our mascot there, the guy with the saw, we call him Joe Wages. He would work the week for the employer and get the wages for that work. And then the employer pays benefits on the carpenter's behalf to the benefit funds. These contributions include such things as health and welfare, pension, annuity, savings plan, the vacation, and the HRA. And day after day, month after month, year after year, when this continues, this is the road that leads to retirement. It leads to retirement with dignity and security. If there's one thing that you remember from my portion of the presentation, is to please check your hours. Check your hours, check your hours, check your hours. You can keep track of your work hours by going to the website, carpenters.fund, carpenters.fund, and then go to that leftmost tile. It says My Profile. After you log in, it'll take you to this page. This is your profile. You see here all of your information, your address, your phone number, your email. If any of this is incorrect, you could change it right here and update it. You'll also see your work history, and this is where you really want to pay close attention. Look at all the weeks that you worked and make sure that those hours tie out to your pay stubs. Make sure they tie out to your records. If any of the employers are short, if you worked 40 hours that week and you only see 32, make sure you reach out to that contractor. Let them know that they were 8 hours short. It might have just been a simple mistake. If you have any trouble with that, please contact us and we'll be happy to help you collect all of those benefits. Benefits are usually paid the month after you work them. So right now we're coming up on the end of October. Those benefits will be due by November 15th. So give them a few weeks and check your hours. Make sure that everything is as it should be. You also see the health and welfare eligibility portion. This will show whether you have benefits for the particular period. And important for apprentices, where you see that yellow arrow, you'll see what your apprentice level is. So as you're coming up to that 2,000, 4,000, 6,000, 8,000 hour mark, make sure you check it and know when you get to the next level. And finally, where it says annuity account, that'll show you whether you're vested in the pension annuity account and the balances in your annuity account. We also mail work record reports 4 times a year. These are quarterly reports, and this gets into a little bit more detail. It shows the annuity rate per hour, the savings, vacation, and HRA rate per hour, and it will again list all of the contractors that you worked for during that quarter and all of the hours that were paid in for your behalf. We mail them 4 times a year, May, August, November, and February. Keep an eye out for them. When you get them, compare them to your pay stubs, compare them to your calendars, and make sure that, again, everything that you worked for has been paid in on your behalf. You've heard me use the term reciprocal form. If you're ever working out of the area, the Eastern Atlantic States Regional Council of Carpenters is a large geographic area, but there are many benefit funds that make up this area. If you're working in the DC, Washington, D.C. area, that's a different benefit fund. If you're working in New Jersey, that's a different benefit fund. We've made it easier than ever. You fill out a universal reciprocal form. It has all of our regions and all of our benefit funds pre-selected. You only have to fill that out once as your lifetime as a carpenter for that specific area, and then hours come back on a monthly basis. One thing you do have to remember, if you work out of area, the vacation benefit does not get reciprocated. So you will have to contact that benefit fund to make sure you get that vacation benefit. You could also fill the recip form out on the website, again, carpenters.fund. Go there, fill it out, and make sure your benefits come home where they belong. If you find that an employer was short on paying your benefits, you can fill out a request for us to review these discrepancies. You could submit your pay stubs right there online, and we'll review them. Someone will get back to you from the collections department to make sure that you're whole. We also administer the vacation and the dependent care benefit, sometimes also called the cafeteria plan. There's 2 ways to get that benefit: taxed and tax-free. You get it tax-free if you choose to get it as a dependent care reimbursement. It says if you have young children and you pay child care for them, you must make that election in the December of the year prior. So this December, you'd be making an election for 2022. All payments for the vacation and for the dependent care reimbursement account go direct deposit, and you can update that information again on carpenters.fund and choose the account that it goes to. maybe you've been working for a few months or a year or two and say, I still haven't gotten any vacation benefits. There's a good chance that they were all sent to the Union Building Trades Federal Credit Union. If you don't have a direct deposit account on file, they automatically go here. You see the website, you see the phone number, give them a call, tell them that you have vacation benefits there. You could either open an account with them if you so wish, or verify your identity, and they'll mail the checks directly to you. So let's go through a quick example of the vacation benefit. Joe Wages, our mascot again, works 160 hours for June, July, and August of 2021. $1 per hour is contributed to his vacation benefit. That's $480. It gets taxed and paid out if it's just a normal vacation benefit. If he chooses to get it as a dependent care reimbursement, he would have had to make that election in the year prior, and he would have to provide receipts for 2021 that he paid child care services, and then, only then, will that money get paid out tax-free. So those are the two ways you could get this vacation benefit. Some additional things that we do here in collections is as change of address, any type of demographic information gets updated. We also have a team of auditors who go out and perform employer audits to make sure that all employers who hired union carpenters paid the correct amount of audits. All the direct deposit information is handled by us. And I'll say it again, please check your hours. Make sure that you get credit for all those hard hours that you put in on the job, that your employer is paying the full amount and the right amount, and you get all those wonderful benefits. With that being said, I'll give it over to Mike Wagner and the medical department.
Thank you, Dave. Good evening, everyone. My name is Mike Wagner. I'm the medical manager here at the Philadelphia Carpenters Fund. And tonight I'm going to give you an overview of the Health and Welfare Fund, the medical department, and what your benefits are that you're working toward. The medical department that I'm in charge of, the things that we primarily do for you as a participant, number one, we track and update your eligibility for medical benefits, and what those are I'll get into in a second. We process, we pay, and we audit the claims, both the ones that we run internally and the ones that our vendors are running for us. We maintain and recruit providers for the benefit funds network. And most importantly, we assist you, the participant, and your family members in regards to your medical benefits, questions you have, bills that need to get paid. In your apprenticeship, if you're a fourth-year apprentice, you might already be used to the eligibility requirements, the work periods and the benefit periods and how that flows. I just want to go over quickly what those requirements are, make sure you know them, and how to stay eligible once you earn it. So I mentioned initial eligibility. If you're a first-year apprentice, you haven't earned eligibility yet, you're going to fall outside of the normal work period and eligibility period that a working carpenter or a guy later in his apprentices used to working. In this case, it's the first time you work 600 hours in a 6-month time frame. So a quick example, and for ease of math, we'll use 200 hours a month. 200 worked in September, 200 in October, 200 in November, there's the 600 hours worked. There is a 1-month waiting period between the month you work your 600th hour and when we turn on the benefits. So if the hours were worked in November, you wait the 1-month waiting period through December, you'd be eligible on the 1st of January. This process happens automatically, so if you know in your head that you worked your 600th hour here in October, expect a packet in early December. We track that at the fund office in the medical department for you. You don't have to call us. You don't have to let us know. As soon as the hours come in to Dave in the collections department, they get transferred over to health and welfare. Look for a big packet in the mail. It'll contain all your documents, and it'll let you know that you're eligible for benefits. Now, once you earn eligibility initially, if you're, again, in your 3rd or 4th year as an apprentice, or if you're a working journeyman, you're required to meet eligibility every 6 months. There's a work period and then a benefit period. So our 2 benefit periods, the first one is May to October. The work period that goes along with that, you need 600 hours. That's the magic number. 600 hours in a 6-month work period. August 1st to January 31st, To be eligible for May, 600 hours. We do understand there are ebbs and flows in the carpentry industry based on the time of year, based on the weather. If the 6 months you didn't hit 600, we do a 12-month look back. So for the May to October period, it's going to be February 1st to January 31st of that year. You need 1,200 hours in that 12-month time frame. Same thing goes for the benefit period where you're just about to come up on. November 1st is our other one. It's November through April of every year. The corresponding work period for that is February 1st through July 31st. You need 600 hours. You don't make that, we again automatically will take a look at the 12-month work period, and that's going to be August 1st to July 31st, 1,200 hours or more. Same thing, the fund office is tracking your hours. We'll make sure that you're eligible. The girls mentioned the My Profile feature. Please make sure that you log in and check that out. Before you get to where I send you a letter that says, congratulations, you either earned the benefit period or unfortunately you didn't earn the benefit period, make sure, so we're about halfway, almost exactly, through the work period for next May. Like Dave said, check your hours, check your hours, check your hours. Go on now and see where you stand on that calculation towards 600, how many hours you need to work in the coming months to make sure that you're going to have benefits for May 1st of 22. In the initial eligibility packet, there's going to be 2 forms I want to make sure you're aware of. As you continue through your career, these forms are equally important, so make sure that you know them by name. The one is called the Annual Enrollment or Coordination of Benefits Form. You may hear us reference it as your COB. Often, if you're out on the job site, it's called the form that puts your vacation check on hold, and it is. It comes out once a year. If you're new, it'll come out in that eligibility packet. It comes out typically February, mid to late February. It's due back every year by April 1st. I can't stress it enough. It doesn't matter if nothing changes. And we get that question a lot. Nothing changed. Why do I have to do this? It's because the fund office needs this form back to make sure we have a good address on file for important mailings. Make sure we have your email or contact info so you know when webinars are coming up. Also, it's the primary vehicle for you to let us know if you guys are young and currently covered under your parents' insurance, let's say. It's how the medical department knows who's supposed to pay your bills in what order. So it's very important that this comes back to us April 1st. It comes out in the eligibility packets, but honestly, the easiest way to do it is go on carpenters.fund. It doesn't even take a minute if nothing has changed. Just click through the boxes, press OK to update that, and make sure that it's on file. Like I said, because it is so important to us and our operations, if it does not come back to us, you might find that your May vacation check gets put on hold. In that case, you got to make sure that you call us, get the COB on file. The other important form is called your Census and Beneficiary Designation Form. Your beneficiary is the person who's entitled to your death benefits in the case that you pass away with healthcare coverage. Joe is going to mention your pension accounts. If you vest in those, they're non-forfeitable. That's your right to give to your beneficiary. The important thing here is knowing who your beneficiary is, making sure it's the right person. Get in the habit periodically. If you do it once a year when the COB comes out, that'd be great. At minimum, do it every couple of years. Log into My Profile. You can click on the left to view your beneficiary. Know who it is, and if you happen to be dating a girl now, you name her as your beneficiary. You guys break up a year from now, make sure that you go in and correct that. Name the beneficiary, the person that you want to. We hear this all the time in the fund office, that it goes to a girlfriend from 15, 20 years ago, and the family is swearing that that wasn't the right person. The beneficiary form legally binds the fund to pay out who you told us to. So again, I can't stress it enough. Make sure that you're going in there and updating that if need be. Once you're eligible, you're really going to have 3 primary cards that you want to make sure in your wallet, or at minimum you have a picture of them. It's going to be your Independence Administrator's card for medical insurance, your prescription card for Express Scripts. Even if you're not already eligible for benefits, you may have the third one as the HRA MasterCard, and I'll get into how to use that in a moment. Your health and welfare benefits, the medical benefits that you're working toward, are really broken up into 4 primary categories. It's our major medical through Independence Administrators. That's what you normally think of when you think of healthcare, doctors, hospitals, blood work. Our behavioral health, counselors, substance abuse treatments. Because that's sensitive information, we actually carve that out to a company that does that solely for a living. They're called mental health consultants. Our prescriptions, I mentioned their card is run through a company called Express Scripts. And then lastly, we do have the benefits that the fund office administers on our own, our fund administrated or in-house benefits. For the two top ones, it's independence administrators and mental health consultants. They share a combined plan. It's a 90-10 coinsurance plan. 90-10, the fund pays 90%, you as the participant pay 10%. And when I say they're shared, it's important to note for the things I mentioned, doctors, hospitals, blood work, you use your independence card, you use their network. That's very important. Make sure that the provider takes the Blue Cross network. For mental health consultants, they actually have their own network. So if you need to see a counselor, if you are married and you need to go to marriage counseling, if you're going in for alcohol or substance abuse treatment, make sure to call MHC. Their number, their website is on our website, carpenters.fund. Reach out to them for help. When I say that they're shared, what I mean is that they have a combined out-of-pocket maximum of $2,000 for an individual or $4,000 for a family. Those terms may be unfamiliar with you. If you guys are young, you haven't really experienced healthcare, and quite honestly, they're unfamiliar to a lot of people in America. We just don't know what those terms mean, so I do want to just hit on it so you understand the basic concepts. So first, what is coinsurance? We're in a 90-10 coinsurance plan. A coinsurance is a percentage of the bill that you, the participant, pay. A copay, on the other hand, is a flat dollar. It's always going to be the same, $5, $10. Some plans have $30 specialist visits. Our plan is a percentage, so it's going to change slightly depending on the doctor, if it's a doctor or a hospital, or what their contract is. But just as a brief example, and for easy math, let's say you go to an office visit with your primary care physician. The office charges $150. What Blue Cross or independence administrators allows for, and they always negotiate, they don't ever pay the doctor what they ask for. So let's say the doctor charges $150, independence allows $100. In a 90-10, the plan's going to pay $90. You as the participant are going to get a bill for the $10 balance. That's your coinsurance. I mentioned the out-of-pocket maximum. So what does an out-of-pocket maximum mean? The out-of-pocket max, sometimes we hear it confused with a deductible. If you have car insurance, you probably have a deductible on that. Your deductible means you have to pay before your insurance kicks in and pays anything. Our plan for in-network services does not have a deductible. That's important. We pay on first dollar claims. So if you go and your office visit was the only one you had, we would pay our $90 without a deductible. An out-of-pocket max really is the opposite of that. It's not the amount you have to pay before your insurance pays. It's the most you can pay before your insurance pays everything on your behalf. We always say 10% as though it's a very small number, and thankfully often it is. But let's say you have a new baby. If you go in for a major surgery, the 10% can really add up quickly. So a brief example, let's say you go in for a knee surgery later in life. The doctor charges $75,000 for that. Again, independence doesn't pay the whole thing. They're going to have an allowable rate. Let's say their allowable is $60,000. 10% of that would mean that you would be out of pocket $6,000, right? We're not talking about a small dollar anymore, $6,000. Because we have the out of pocket, you're shielded from that large amount of money. The most you can pay in any plan year, and that's an important term, your plan year. Every year, our plan year is May 1st through April 30th. That's when our accounts renew. So you're out of pocket from May 1st through April 30th. The most you can pay as an individual is going to be $2,000. Let's use that same example. The doctor charges $75,000. Independence allows for $60,000. In this case, because we have the out-of-pocket max, you're not going to pay the $6,000. If this were your first claim, you'd pay the $2,000. You would then be considered maxed out for the plan year. So the fund's going to pay the remaining balance on that bill. And then from there on out for that plan year, May 1st through April 30th, the fund will pay all of your bills through independence and mental health consultants at 100%. So that's the definition of the out-of-pocket max. It's important to note, just to reiterate again, $2,000 for an individual, $4,000 for a family. With that said, now how do you know what to pay? It's important to note for both independents and mental health consultants, They're going to provide an explanation of benefits, an EOB for short. They mail out, I believe, once a month in a thick envelope. It's going to give you the full breakdown of how they process the claim. It'll have all those features I just mentioned. But really what you as the participant want to care about is your doctor should be sending the bill to Independence, finding out what their allowable is, getting their 90%, and then billing you the 10%. Make sure to open your bills. Make sure to read through them. And the reason I stress that is sometimes they don't submit it to Independence. Sometimes they didn't take a copy of your card, so they don't submit it anywhere. What you want to pay attention to is make sure that if they charged $1,000, that you see the proof underneath of there of where the insurance paid our piece of that. You should be looking for just your 10%. If the number isn't the 10%, if let's say they charge $1,000 and they bill you for the $1,000, make sure to call the fund office. And that's why I bring up, how do you know what to pay? I can't stress this enough, really. When the bill comes in, make sure you're taking action on that. If you ignore a medical bill, and like I said, sometimes it happens, the front desk doesn't take a copy of your card, they don't bill it anywhere. Unfortunately, your insurance never finds out about that. We as the fund office, we don't find out about that unless you make us aware. If you ignore it, it goes to collections, it goes on your credit report, and all too often people are calling the fund office when they go to buy their first house, and they find out that their credit score is in the 500s because of an outstanding bill that we could have paid. Dave gave you an example that it's always easier for the collections department to take action with the least amount of time in missing hours. If you wait a year, it becomes harder. 3 years, it becomes harder. 5 years, almost impossible. Same goes for medical benefits. If you get a bill, so within that first year, it's very easy for you to call and give your ID card, or the fund office will call and make sure that they know where to bill that. If you wait 3 years until you're buying a house, it's on the credit report. Now you have to negotiate with a credit bureau trying to get your claim or trying to get our payment. 5 years, sometimes it's impossible for us to help you out. So please make sure that you pay attention to those bills. And if you have a problem, like I said at the start, our primary job is to help you with that. Call us, make sure that we're aware of it, and can make sure that we help you out. Your prescription coverage goes through Express Scripts. It's got a separate card. Very quickly, this one is a copay plan. The important thing to note is get a generic when you can. Our generic copay, $5 or $10. If you do require a brand medication, in that case, it converts to a coinsurance. You're going to pay a percentage of that. For a 30-day supply, you're going to pay 25% of the cost of the drug, but you'll never pay more than $75. For a 90-day supply, you pay 25% of the drug, but never more than $150. The important thing to know about a 90-day supply, any drug you fill more than 3 times, you're required to use one of 2 avenues. That's why they're listed here on the left. It's either Express Scripts mail order or CVS walk-in pharmacy. I bring that up because if you fill the drug on the 4th time and you don't use one of those 2, you're going to pay 100% of the cost of the drug. If that happens, and you'll see the bottom category here, non-preferred. Non-preferred drugs, you're paying 40% of the cost of the drug. If ever you're paying more than the 5 or 10, 75 or 150, before you do that, call the fund office. Call the fund. If it's a simple matter of you're in a Walgreens and you need to be at a CVS, we can help you get it directed to the right place so that you're not paying 100%. If it is a non-preferred, we can let you know what the preferred brands are, get it switched over again so that you're not paying more than you need to. If at any point in time you run into that, please call the fund office first. It's very hard to get a prescription refunded, so call us if ever it's not 5 or 10, 75 or $150. The in-house benefits, the fund administered benefits that I mentioned earlier. If you're eligible right now, you should be getting your dental and your orthodontia or your braces benefit through us. Your vision benefit. If you take an ambulance ride, that claim actually comes to the fund office and we make our payment. And also if you require hearing aids currently, that benefit's going to come here as well. I do want to make you aware of 2 changes that are coming up. It's to our dental plan and our vision plan. Right now they're fund administrated. So the claims come to my office and we make payment. The doctors and the network are run by us. If you have eligibility, they actually call down to the fund to make sure you're eligible for these services. The board decided to give those out to larger vendors similar to Independence. Our dental plan is going to be run through Cigna Dental. Our vision plan is going to be run through Davis Vision. These are good changes for you as the participant. It's going to increase the size of the network, hopefully bring more people in network so you're paying less out of pocket. It's going to give you more selection, give you a true ID card that you can make sure you use. We haven't gotten everything ironed out yet, so I do know that it's going to Cigna. We know that for vision it's going to Davis. But the important thing, and the girls mentioned at the start, is our communications effort. As we get more of those details ironed out, as we get closer to May 1st when this change is going to take place, make sure you're reading the newsletter, follow us on social media so you see those updates, and read the mail that we're going to send out to you so you know how that change is going to impact you. Like I said, we're pretty excited about it. We think they're good changes. We think you're going to think so also. The benefits I want to make sure that you know by name tonight. So those are our major categories, the four I mentioned at the start. But I do want to make you aware of our zero copay benefits. You have to pay the 10% on independence. You pay the copays on Express Scripts generic drugs. We're always looking for ways to help you as the participant avoid having to make those payments if we can. So I want to call out the advantages you have here. The top left corner, MD Live, Progress Physical Therapy. We know that as a construction worker, you're going to eventually need physical therapy. Knees go bad, shoulders go bad. To help you make sure that you're going to the 30 visits that you're entitled to a year, there's no reason to not. We make sure if you use a Progress Physical Therapy location, you can find them all listed on carpenters.fund. You're going to pay $0 for each one of those visits. It's a company called Healthcare Solutions. They do our radiology, again, at zero copay. 10% on an x-ray or CAT scan can be pretty sizable sometimes. So we wanted to make sure that there, again, no reason to skip that. Call Healthcare Solutions, get an authorization number. That way you don't pay the 10%. Same thing for blood work. As long as you utilize a LabCorp facility, if your doctor draws blood and asks where to send it to, have them send it to LabCorp. In that case, you're going to avoid that 10% also. The Temple Health scans right now, if you're under 40, probably not so applicable, but I do want to make sure that you know they're available, number one, for when you get up to that age, or if you have a family history of heart problems or lung problems, call down to the fund office. We can get you in for those scans, again, at no cost to you. And then if you are a diabetic, type 1 or type 2, we have a new company called OneDrop. The testing supplies for your insulin levels, they can, again, add up very quickly. So we wanted to make sure there's no reason to not be doing those tests. OneDrop will supply all of those testing supplies to you at no cost. Before I move on, I briefly went over the top left corner, MD Live. I do want to just elaborate on that a little bit. What MD Live is, it's called a telehealth app. Download the app tonight when the webinar is over, no reason not to. Sign up for it in advance. What it is, it's really a doctor on your phone. So as opposed to going to the urgent care, if you have small symptoms, if you have allergies, sinus infection, pink eye, whatever it might be, avoid going to the urgent care. Number one, they're busy. Number two, you have to miss work. Number three, you're going to pay the 10% coinsurance. MD Live, you can do right from your own couch. I think when we ran our numbers before, the average visit took 12 minutes. So you can do it faster than a football halftime. Do it from the comfort of your couch. Avoid the 10%. Make sure that you have that app downloaded and that you subscribe in advance. That's an overview of our benefits, what the fund pays, what you as the participant are going to have to pay out of pocket. I do want to touch on the Blue MasterCard that I mentioned earlier, your HRA account. It's the other half of the vacation. That will help cover those costs for you. So your HRA, like I said, it's the other half of the vacation. When that contribution comes in, gets split in half to your vacation fund, half to your HRA fund. And what the HRA is there to do, it helps cover your out-of-pocket medical expenses, so 10% coinsurance, or the $5 or $10 copay. It's tax-free. So unlike the vacation check where you get taxed unless you use the dependent care avenue, this one is truly tax-free. So it goes in, if you get $100 in there, you get the full $100 to help pay for those expenses. There's two ways to access the account. It's the Blue MasterCard on the left, or the web portal or mobile app. If you do happen to pay out of pocket, you don't use the MasterCard. The difference between the two, the Blue MasterCard, you swipe right at the point of sale, nothing comes out of your pocket. If you do pay out of pocket, you have to submit a receipt to us. In that case, you use either the web portal or the mobile app. I suggest downloading the mobile app when the webinar is over tonight. That way, if you do pay a bill out of pocket, take a picture and upload it right there, and then the fund is going to reimburse you the difference. The web portal login is slightly different than your Carpenters Fund login. It's going to be your first initial, your last name, and the last 4 of your social. The password is Carpenters in all lowercase. I want to mention this, if you have never logged in before, if it's been a little while, that default password might have reset, or if you did log in and haven't remembered your password, please reach out to the fund office. We'll get that reset for you. So I mentioned the 2 ways to utilize your HRA. It's important to note there was some initial confusion. We had participants who thought they would submit a claim and the money would go on to the HRA card, sort of like a gift card. It's not really. It's 2 ways to access the same account. The MasterCard, so you don't have to pay out of pocket. If you do pay out of pocket, like I said, the web portal. But I do want you to note that there are some things that the card doesn't work for, and that's by design. It's going to be dental treatment, vision care, or ambulance rides, basically the fund administered benefits. The reason we have the card turned off there is we don't want you to go to a dentist. You get a root canal for $1,000. If the dentist knows you have insurance, and I'm not saying it's all dentists, but it could happen. If the dentist knows you have insurance, they know, just like independents, we're not going to agree to pay the $1,000. We're going to offer them $550. If they know you have an HRA, they may just take that card and swipe it for $1,000 and off you go. We want to make sure that since you have a dental benefit, you have a vision benefit, you're using the fund's money before you tap into this HRA. So for that reason, we don't allow the card to work. When we do make that move to Cigna and Davis Vision in May, in that case, because the dentist knows they're going to get paid up front from those 2 companies, we will turn that feature on for you. That way it's seamless. You don't have to come out of pocket. But if between now and May, you do pay for dental treatment, in that case, it's going to come through the web portal or the mobile app. Some things that are never HRA eligible, and I only bring them up because we do get these questions. You can't buy groceries. Doesn't work at a gas station. Toiletries, unfortunately, not allowed. Same thing for restaurants. And like I said, there is some confusion. People thought that if they submitted claims, the money was going onto that HRA card. It won't work at an ATM to try to get cash. Just another means to hit your account. To help illustrate the difference here, I'll just give you a quick example. If you were to use your MasterCard for, let's say, the $10 copay at the pharmacy, if you have, in this example, a $500 HRA balance, you swipe your MasterCard and $10 comes out. In that case, the new HRA balance, $490. Like I've been saying, no money out of your pocket in this case. If you forget the HRA card, if you don't have it on you and you show up at the pharmacy, same thing for the $10 copay. Current balance $500. In this case, you would have had to pay either cash or with your own debit card the $10. You submit your claim and receipt through the web or through the app. Again, the balance comes down to $490. The difference here is we're going to direct deposit the $10 back to you. What we always tell people, you can pay your independence bills. So when you get that bill, you reviewed it to make sure that we paid. You know it's your 10%. Just like you would call and pay with your own MasterCard, call and pay with the HRA card. For the pharmacy, just give them the HRA card. Their systems are designed to know what's eligible and what's not. Better to have it go and them say, look, this isn't eligible, and then you pay with your debit card. So try the card first, but in the event you have to use the web portal, that's the process that it goes through. The preventative health, I want to focus on preventative health. We always do with the mid-career carpenters and the retirees, but it's no less important, if not maybe more important, when you're a kid, to make sure that you know what you're entitled to and make sure you start this habit early. So the important ones, and there are a lot of preventative care that as you get older, it changes slightly what you're entitled to. Make sure you're staying in contact with independents or the fund office to know. But the basics are your comprehensive annual physical through the fund office. I'm going to bring up patient first in a slide. I'll go over how to get that benefit. Your annual eye exam, even if you can see 20/20, it's very important to get the annual one. It might not sound like a life-saving endeavor, but a lot of times they can pick up things behind your eyes like diabetes or cancers. So make sure you're going through that once a year. Obviously, your dental checkups twice a year, that's covered at 100%. Your primary care annual wellness visit, very similar to the annual physical, but this is through your primary care physician. The millennial generation, not so in touch with a primary care like maybe our grandparents were, but it's important that we get back in that habit, have someone who knows you as a person, knows your health, is in touch with the changes as you go through it. So please find a primary care physician, and the fund can help with that. Go to your annual wellness visit once a year. Nutritional counseling is a big one. It's no secret, the American diet is probably the worst on the planet. If you need help understanding your diet, losing weight, eating better, or if you happen to be in the gym and your diet's already perfect, a nutritionist can help make subtle tweaks. You're good for that 6 times a year. You can find them on Independence's website. And then most importantly, especially right now, the topic of the day is vaccines. All your vaccines are covered at 100%, both the COVID vaccine, if you haven't gotten that already, and then year over year, the important one is your flu shot. Make sure that you're signed up for that. Give your Independence or your Express Scripts card, either one works, and those are covered at 100% as well. The patient first physical, it's part of the comprehensive physical, that first preventative measure that I mentioned. We at the fund office were very excited about this. It came out February 1st of this year. It's important to note, you can see it on the slide, if you do utilize this, we will actually give you a $25 gift card. If you're married, we'll give you and your spouse a $25 gift card. As an apprentice, chances are you're under 40 years old, so you're entitled to this benefit every other year. Once you hit 40, it's going to be every year. Your preventative care as a young person, you probably feel invincible. I know all of us do in our 20s. The truth of the matter is the habits you establish now are going to carry through with you in 2-year later career when you hit retirement. So please set this up as a habit. Go every other year while you're entitled to it. They're open 7 days a week, 8 to 10 p.m., including holidays. We know the number one struggle as a construction worker, I mentioned it earlier, your eligibility is tied to hours, your pension's tied to hours. Dave said the hours are the most important. It's hard to take a day off of work to go get a physical. We know that. So we coupled with Patient First because they have the night and weekend hours. Physical takes about an hour to an hour and a half. They're going to give you a full picture of your health, blood work, and EKG, height, weight, and BMI. Like I said, get in the habit. Please go. We'll give you $25 if you do. I would hope, and honestly, we're not good at it. Every meeting that Joe and I attend about the fund's overall picture of health, we hear from everyone that we need to do a better job of getting our physicals, of using our preventative health. So I'm asking everyone, if we have 200 people registered for tonight's webinar, I would hope to get 200 Patient First bills in the next couple of months. Go utilize this. Know where you stand in terms of your health, either that you continue your good habits if that's the case, if you have small things to tweak, that you know what to tweak and get started on that. So please utilize Patient First, visit the Carpenter's website, get the $25 gift card. In the event that you use Patient First, if you happen to go in the hospital, I want you to know about the fund's nurse team. They're an advocate for you. So I've given you an overview of your benefits. They're complex, we know that. The medical world is a complex field, even for those of us that work in it. If you're fresh out of the hospital and they've given you a new medication, if you go to Patient First and they did find something you should be concerned about, if you just have general benefit questions, or if you don't have a primary care physician and you're interested in getting one, know that our fund nurse team is here for you. They're an advocate for you. They do not report back to me. They don't report to your employer. They don't report to the board. They're trained by Temple Health. So if you deal with either Nurse Fran or Nurse Nicole, you're going to hear them say they're a Temple nurse. So they're clinically trained by Temple here in Philly, but they're a fund employee. They're here as an advocate for you. Please utilize them. Their email's here on the screen, care@carpenters.fund, or call down to the fund office. Have them help you with whatever medical benefits that you need help with. And lastly, before I wrap it up, just one other in-house benefit that I want to make sure you're aware of is our weekly disability or supplemental work comp benefit. If you're hurt on the job, we'll start at the bottom. If you're hurt on the job, it's going to go through the work comp benefit. your employer has workman's compensation, they're going to cut you a check. The difference, and I know that we've already harped on it, is hours, hours, hours. They're not required to put hours into the benefit fund. So even though they're giving you a check, you're going to miss out potentially on health and welfare eligibility. Maybe you put your pension year in crisis. If you're on work comp, please call the fund office. We're going to put you on our supplemental work comp benefit. It does come with a small financial amount. It's $100 per week for the first 15. But the important thing here is that we, the fund office, are going to credit your health and welfare and your pension fund with 30 hours a week while you're out on comp. So call us, make sure that you're getting those hours. That way your eligibility stays intact, your pension years stay intact. Now, if you're hurt off the job, in that case, work comp doesn't have to do anything for you. So no paycheck, no hours. In that case, again, please call the fund office. We can get you set up so that we sort of become your employer. We're going to give you $550 a week. And again, the important thing is 30 hours a week toward health and welfare, 30 hours a week toward your pension fund. I can't stress this enough. Don't listen to Joe on the job site. We hear it constantly. So we're coming up on the November 1st eligibility period. I've probably already gotten 15 calls saying, but I was hurt. Why can't I have the disability? On these two benefits, you can't collect unemployment. And you might hear that from Joe on the job site. Just go on unemployment. The money may be slightly higher than our 550, but they don't give you hours. And unfortunately, if you take unemployment, I would have to deny the hours. So call us, make sure you're getting the health and welfare and the pension credit, sign up. You have to let us know you're hurt within 30 days. That's why I put the stress on that. To please call the fund, get an application, make sure the injury is on file. That's your benefits as an overview. I could spend all day, if I haven't already, I could spend all day elaborating on the benefits. We're excited about them. You guys work really hard to make sure you have the best benefits in the industry, and we really believe that you do. If there's anything that I went over too quickly or not enough in depth, please visit carpenters.fund. All the information's there at your fingertips to know how to utilize the benefits. If you need help, call the fund office. Like I said from the start, that's what we're here for, is to work for you guys to make sure you know the benefits you're entitled to. And if there is anything, please ask during the Q&A session. And with that, I'm going to turn it over to Joe to give you a rundown of your pension benefits.
Thank you, Mike. As Cassie and Nicole mentioned in the very beginning, my name is Joe Obahowitz. I'm the fund director here at the Carpenters Benefit Funds. My portion of the presentation tonight, we're going to dive into your retirement accounts, most notably your pension account, your annuity account, and your savings account. We're going to talk about vesting and what that means. We're going to talk about credited service under the plans, and then we'll dive into how the accounts work and what you should be looking for when you're eligible to retire. The retirement department, now what do they do and how do they fit under the umbrella of the fund? Well, one, they're responsible for administering the pension, the annuity, and the savings plans. They calculate all of your statements, including your pension statement, when they're requested by the participant. They process all of the paperwork for future retirement appointments. And most importantly, they ensure that your pension, annuity, and savings amounts are accurate and in compliance with government statutes. Now, what are you working towards and why did you join the union? I always like to show this slide as a snapshot. And these are the average numbers of somebody retiring between 25 to 30 years of service. That when you come in to retire after a long career, the average carpenter, millwright, dock builder, floor layer, cabinet mill has an average of about $300,000 in their annuity account. On top of that, they have approximately $80,000 to $100,000 in their savings account. Now, again, this is a savings account that's set up through the fringe benefit package. I'm not talking about your personal savings account. And then you would typically retire with a average pension somewhere between $5,000 to $6,000. I know you're not thinking about retirement right now, but down the line, this is going to be important. And think of what these numbers might look like in 20 to 30 years from now. They could be doubled from that time period. The time does go quick, so make sure you do stay on top of all of your retirement accounts and know that they will be there for you when you come to retire. And this is what it's all about. It's all about, the getting up early, the daily grind, the travel, the bad foreman that you might be working for, that it's worth it. and that there is going to be security for you at the end of your career. Now, how do you get there? How do you get to those numbers? One, most importantly, you need to be vested in your retirement accounts. And what does the word vesting mean? The word vesting means you have a 100% ownership and non-forfeitable right to those accounts. In order to qualify and become vested in your pension, your annuity, and your savings plan, you have to have 3 years of credited service. And I'll explain credited service and how you earn credited service on the next slide. The pension plan year, the savings plan year, and the annuity plan year all start May 1st through April 30th. That's what's considered the plan years for retirement. Now, we talked about vesting and credited service. Now, how do you earn that credited service? Well, it's simple. If you look at the chart, if you work less than 200 hours in that plan year, which is May 1st through every April 30th, you don't earn any type of credit. If you have between 200 and 399 hours, you earn a quarter of a year credit. If you have 400 to 599 hours, you earn half a year credit. If you earn 600 to 799 hours, you get 3/4 of a year credit, and 800 or more hours will get you 1 full year of credit. Now note, your very first year has to be a full credited year, meaning you have to have at least 800 hours in order to qualify for either the quarter, half, or 3/4 of a year credit. But once you have 3 years in total under these guidelines and have 3 years of credited service, you will become vested in your retirement accounts. And again, that's a non-forfeitable right, and they are considered yours. Now let's look at an example of how the credited service works. As I mentioned, the plan year starts every May 1st and ends every April 30th. In this instance, the participant worked 1,400 hours. Therefore, they earned 1 year of credited service. If we look at the next plan year, which is again May 1st through April 30th of 2019, the participant worked 1,500 hours. They earned 1 year of credited service for that time period. Now, if we look at the following plan year, May 1st of 2019 through April 30th of 2020, the participant worked 1,700 hours. They earned another plan year. When you total the 3 years up in total, they have 3 years of credited service, which qualifies them as vested under the retirement accounts. You should also know that as a participant in the school, your school hours do get credited towards that vesting service. Your pension plan. I'm going to give you a simple overview of the pension plan, as this is considered a defined benefit plan, and it would be paid out to you monthly after you retire. The contribution amount is included in the fringe benefit package from your employer, and the calculation is based upon a yearly accrual that is set by the Board of Trustees and the credited service, as I just mentioned, that you earn while you're working. As I mentioned earlier, I'm sure you're not thinking about it right now, but the time does go fast. So when can you retire under our plan? Well, the earliest you can retire under our plan is when you're the age of 52. But in order to qualify to retire at age 52, you have to have 33 years of credited service. You can retire at 53 if you have 32 years of service, 54 at 31 years of service, 55 at 30 years of service, and you can retire at 62 with at least 10 years of service. If you qualify for that, again, you can retire and you will not take any type of reduction in your pension. You can qualify to retire at 55 with less than 30 years of service, but there's a different calculation that gets involved. And those are things we'll go over when you're closer to retirement age. Some other pension features that we can talk about too is a supplemental benefit, also known as the double bubble. So your pension could double depending upon the amount of years you have in at the time of your retirement. There's also a disability retirement option that if you are vested and make certain qualifications, if you get deemed disabled by the Social Security disability by the government, you might be entitled to your pension earlier. And also there are death benefits that would get paid out to your spouse or your beneficiary in the event that you pass away before you retire. If that's the case, make sure that you always have your beneficiary information up to date. Okay, now let's look at your annuity account. The annuity account is considered a cash balance or hybrid defined benefit plan. The annuity contribution is included in the fringe benefit package from your employer, as a set dollar amount that gets allocated to your account for each hour you work. The amount is credited with an interest rate, and that's based upon the average of the 30-year Treasury rate in the month of March before that plan year starts. For the May 1st, 2021, April 30th, 2022, that interest rate is 2.34%. And when you come in to retire, you're going to have some payment options. You can take it as a monthly payment, you can cash it out, or you can roll it over. Again, as you get closer to retirement, we can go over those details with you. Now, once you're vested in your annuity account, you should receive an annuity statement. Typically, it comes out towards the end of summer. If you think you're vested and you did not receive an annuity statement, please reach out to the fund office and we can look into that for you. So as you can see on the statement, there are two accounts. There's account A, and that is for contributions before May 1st of 2018, and account B, they're for contributions after May 1st of 2018. Both accounts are calculated the same way, as I mentioned, using that Treasury rate. The only difference is account B has a cap of 6%, where account A has no cap on the interest rate. The total of the two accounts is your annuity account balance. Just a quick example, in March of 2019, the Treasury rate was 2.98%. So account A and account B would earn the same amount of interest. However, if that interest rate was at 8%, let's say, account A would earn the 8%, account B would only earn the 6%. Another retirement vehicle we have is the Carpenter Savings Plan. Now, the savings plan is considered a defined contribution plan. It's also included in the fringe benefit package as a set dollar amount that gets allocated to your account for each hour you work. Now, the difference between the annuity account and the savings account is this account, the savings account, is considered a participant-directed investment account. Now, what does that mean? That means that you, the participant, have control on where the money can be invested. Now, when you do come in to retire down the road, you're going to have the option of either cashing it out and having those tax consequences at that time, or you can roll it over tax-free to another financial institution. After you have contributions contributed, you will receive a welcome package from the Newport Group. And the Newport Group is the day-to-day record keeper of the savings plan. We at the fund office are the administrator of it, but the Newport Group is the day-to-day record keeper. They will send you a quick start guide, and they will highlight all the information to access your account through the Newport Group. And we also suggest that you download the Newport mobile app. There's a link on our website that will direct you to the Newport site. You will also receive a statement each quarter, regardless of your vesting status. So some of you may have already been receiving the quarterly statements that get sent out by the Newport Group. As I mentioned, this is considered a participant-directed investment account that you have access to the account right away where you can move money around. However, you do not have 100% ownership in that account until you meet those vesting requirements. And if you are vested, that would show on the statement. As I mentioned, you can go to our website and link to the Newport Group that way, or you can go directly to the Newport Group. The information is above. They also have a 1-800 or 1-844 dedicated phone number that you can contact Monday through Friday, 8 to 8. It's also available in Spanish. And for information on how to log in, you can, again, go right to the Newport website, or you can look at carpenters.fund. As I mentioned earlier, the difference between the annuity and the savings account is the savings account is considered a participant-directed investment account, meaning that you have the option to build your own portfolio. The plan offers 15 investment options. It's a mix of stable value funds, bond funds, large cap, mid cap, small cap. Now, if you're savvy enough to navigate through this or have somebody that can help you out, great. You can do your own research. The Newport Group's website has a lot of great tools on it. So we suggest you get on there, do your own research if you can, take some time, look things over, see what the best option is for you. However, if you're not savvy enough or you just don't want to deal with it or you're overwhelmed because this isn't what you do, that's okay too. That's why if you look at the bolded default funds, you'll see that these accounts are set it and forget it. The money auto defaults to one of these accounts based on your date of birth and adjust accordingly, meaning that it'll get a little bit more aggressive the younger you are, but as you get older, it'll get a little bit more passive in the investment options as you get closer to retirement age. But again, we suggest you do your own research. If you want to set it and forget it and leave it in those default funds, great. It's pretty much doing 70 to 80% of that weight lifting for you and managing it on its own. But if you're savvy enough, there are different options, and you can do your own research on the Newport Group's website. An important feature in the savings plan that is not in the annuity plan or the pension plan is the savings hardship withdrawal. Now, what the hardship withdrawal allows you to do is take money out in the event of a hardship prior to your retirement. In order to qualify for a hardship withdrawal, you got to meet a certain criteria. You have to be vested in the plan, and I explained how you become vested. You have to have a balance of at least $2,000 in your savings account. You're only allowed to take up to 50% of the account balance up to $50,000. You're allowed one withdrawal every 3 years. And most importantly, and these are IRS guidelines, these are not carpenter guidelines, is that you must meet one of the 5 criteria. If you're purchasing your primary residence, if that's something you want to look at down the road, most of you are young, whether or not you already have a house, great, my hat's off to you. But if it's something you're thinking about doing, we can help you through the hardship withdrawal to help purchase your primary residence, to save your home from foreclosure, or if you're being evicted, to pay outstanding or upcoming medical expenses, for funeral expenses, or for post-educational expenses for you, the participant, or eligible dependents. Again, this is an option that you would have under the plan. There are certain criteria that you have to meet, but there is a hardship provision that would allow you to take the money prior to retirement. There are certain tax consequences that do come along with taking the withdrawal early. If you feel like you are in one of these hardships, please contact the retirement department and we can look into it and see if you do qualify. Just a quick closing and recap before we get into the Q&A. Just remember, there's a lot of communication tools that we have available for you as an apprentice and as a member through your career. Please make sure you're using them, whether it's the website, reviewing your hours online. Dave mentioned check your hours, check your hours, check your hours. I can't stress how important it is that your hours drive everything to your
Hi,
retirement,
everybody. I hope that was
to your
informative for
healthcare,
you. We'll now
everything.
get into
So
the
make sure that
question
you're up to
and
date
answer. We have a lot
on
of great
checking your
questions
hours.
coming
And
in.
again,
And I have
if there's
Nicole
any
on the
issues,
back end monitoring
make
your
sure you
questions.
contact
Just
us
in
and let
case
us
there's
know.
a bit of personal
We talked
information in
about
them, we won't answer them
reciprocal and
here,
working out
but
of
we
the
will have
area.
somebody from the fund
One
office
big
contact
union,
you
how
separately
important it is to
tomorrow
make
or
sure you have
within
a
the next
reciprocal
week.
form on file.
I'm going
so
to
those
bring the
hours
panel
get
back
credited
on
to your
with me
account.
to answer your
The
questions as I
vesting,
read them.
how important it is, and once you become vested under those 3 years, how you get those credited service, and how you have a non-forfeitable right to your account once you're vested. Mike, during his presentation, talked about preventative
Okay,
health.
I have Dave
I can't
Latushko,
stress
the
how
collections
important it
manager
is. You
here
might
with
not
me,
think about it now,
Joe
but use your
Obahowitz, the fund
preventative
director,
health measures. Make sure you're
and
getting
Mike
yourself
Wagner, the
checked
medical manager.
at least
All right, let's start answering some questions.
once a year
First one.
to make sure that you're fully
How do I
functional and
how do I
up to
find
date
my
and
login
healthy.
information
And God
for the
forbid, if
website?
there is an underlying issue, you take care of it
Sure.
immediately.
That's right on the website. We have
Dave's
a login
presentation, we
video
talked
actually
about
on
the
YouTube.
vacation and the direct
That's the
deposit.
easiest
Make
way
sure the information is always
to
up to
find that
date.
video. We're making
The
it a little
beneficiary
easier to find
information.
it,
Again, I
on
can't
my
stress
profile
how
page.
important it is to make
And
sure that
then
we have the
also
most
your
up-to-date
generic
beneficiary
login, your
information
last name
on you at the
and
fund
last
office.
four of your social,
God forbid if something happens
all
to
in
you,
caps,
and no one can plan for that,
and your generic
that if you are vested in your
username is the
accounts,
year you were born,
any benefits that
4
would be due to you
digits,
would get into the
and
right
the first
hands
2
and go
letters
to
of
the
your
rightful
first name,
beneficiary.
also in caps.
Mike talked about the
We
90-10,
have
how that works,
a similar
understand how
question.
that works
It says, what
as
is the
far
app
as
and is it the same
the amount of
login
money
as the
you would pay out
website?
of pocket in the event you had
The
to go to
app
the hospital,
is
doctor, etc.
just a simplified version
Also, the
of
nurse
the
program.
website, and it is
If there's
the same
any
login
issues,
information.
God forbid you do have an issue or a health question, you can always contact the nurse here at
How
the
many
fund
hours
office.
do you
That's
need
what
to
they're here
start
for.
benefits?
The MD
Yeah,
Live,
I'll take that one.
which is the
then.
teledoc
Hopefully I
option,
hit
to
on
where you
that
can
in
contact the
the
doctor on your own time. We
initial
understand you're
slide,
busy, you're at work.
but the short answer is
You
600.
can contact the doctor
So
at
once
any
you hit your
time.
first
There's no
600 in
excuses.
6 months,
And then also
the fund
understanding how your
automatically tracks
HRA
that and sends you
card
an eligibility.
and how your HRA account works and the difference between the two.
Can you
And
go more
as
into
always,
the child
if you
care
have
dependent
any
election to become
questions,
tax-free on the vacation check?
any issues, go to the
Certainly.
website or
So
contact
every
the fund office.
December,
That's what we're here
we
for.
mail
We're here
a
to help
dependent care
navigate
election
your benefits.
form.
That's
It's
our
also
job.
available,
And
on the
please, if you have
website,
any questions,
and you can
any
download it
issues
and fill
at
it
all,
out there.
to contact
You have
us.
to let us know that you want to
With that,
elect
I'm going to turn it over to
receive
Cassie
your
and Nicole, and we'll tee up the
2022
Q&A.
contributions as untaxed dependent care reimbursement. At that point, your vacation money will go on hold. It won't get paid out on a quarterly basis like the vacation will, and we'll wait until you provide 2022 dependent care receipts. You can do that through the website as well. You can send that in, you can mail it in. Once we receive a copy of those receipts with the dependent care reimbursement form, we'll pay out that money as a dependent care reimbursement. That will be tax-free. It still goes on those same time periods: February, May, August, and November. However, you have to submit receipts before that gets paid out.
All right, thank you, Dave. Next question. How do I sign up to get a physical?
Yeah, so the physicals, if you've been in for a couple of years, already been through it, you used to have to call the fund office and get an authorization number from us. One of the main reasons we like Patient First is being that they're open all day long, 365 days. We took that feature away. We really want to make sure that if you're interested in getting a physical, you go out and get it. So there's no barrier anymore. You don't have to sign up. Literally just walk in any Patient First, tell them you're here for a carpenter's physical, and they'll get it done for you.
How do I become vested?
I'll take that one. As far as being vested, you have to have 3 years of credited service in the pension, annuity, and savings plan. The retirement accounts follow the same vesting periods, and the vesting period starts the plan year starts every May and ends every April. You have to have 800 hours in order to qualify for one plan year. So as long as you have 3 plan years of 800 hours, you become vested. As Dave mentioned, you can check your vesting status under the My Profile page. It'll have in the box where it tells you your annuity account balances. And there's a flag there that will tell you whether or not you're vested or not vested in the annuity account. If you're vested in the annuity account, more than likely you're vested in all 3 of your retirement accounts.
I have not received my vacation check this year. How do I receive that money?
Sure, that's a great question. There's a couple of reasons why you may have not. One is tied with your COB, your Coordination of Benefits form. If you haven't filled that out for this year, for 2021, you definitely have to fill that out, or it will put those vacation payouts on hold. Also, there's a chance that you don't have a direct deposit information on file with us. In that case, your money would have gone to the Union Building Trades Federal Credit Union. And we have that information, their contact information on our website. It was also part of the presentation. You'd reach out to them, and you could either have them send you that money as a check, or you could open up a account with them if you so choose.
Okay. I've heard guys tell their doctors to just bill the fund office before paying anything, and they will negotiate down the bill. Is that a thing?
So part of that is somewhat accurate. The thing you want to note is don't pay the doctor before they bill the insurance. So not necessarily the fund office. Make sure if you're going to a doctor's office that it's your Independence Administrator's card. So make sure it goes to Independence, and then like we talked about on the page displaying the bill, as long as it shows on there that the insurance made a payment, you know it's your 10%. In that case, you can go ahead and make the payment to the doctor.
Okay. How do I know if I have to fill out a reciprocal form?
I'll take that question. Our geographical region as a council is very vast. And if you're ever working outside of the Philadelphia area is Eastern Pennsylvania, the 5 counties, the entire state of Delaware, and the Eastern Shore of Maryland. If you're ever working in areas such as New Jersey, New York, whether it's New York State or New York City, If you're working down in DC, you have to fill out a reciprocal form. And then obviously, if you're even outside of that, if you're working in California or Alaska or Hawaii or Louisiana, you have to fill out a reciprocal form. When in doubt, just fill it out and send it in, and we'll make sure that those hours come back home safely.
Okay.
Just a quick follow-up on that, Cassie. We do have it on our website, so you can fill it out very easily on the website. Just let us know. There's no harm in filling it out beforehand, even if you have no intentions of working in the state of New Jersey. It's always better just fill it out. It's on the record. Again, as Dave mentioned, that allows us to go to that home fund and it just ask if you work there and if you do send back those hours.
Okay, thank you. How do I change my beneficiary?
Yeah, so I mentioned that you can check your beneficiary, and it's very important that you do so periodically on my profile. You can check it electronically. How do you change it? Right now, because of how official it is, you're assigning monies to someone else. We do ask that you fill out a paper form, so you should get one in your initial eligibility packet, or if you know that you need to make a change, either email the fund office or give us a call. We'll get one of those forms mailed out to you, send it right back, and we'll get it updated.
How do we get the HRA cards replaced if they are damaged?
If they're damaged or if you lost them, same thing. Contact the fund office. We'll order them. They come out in sets of 2. So we'll get them ordered and send them out to you.
Okay.
It's very important. Let me add to that. It's very important if you do lose it, because literally it works like cash. Call us so we can get you a new set of numbers. You don't want to lose that and have someone take it to the pharmacy and swipe it. It doesn't know that Mike Wagner is scanning Dave Latushko's card. It just knows that it's a card with money on it. So if you do lose that, same as damaged, please call us. Make sure we get you a new copy.
Okay. Here's a similar question that I think you kind of just answered. Can I get more than one blue card, one for me and one for my wife?
So yeah, absolutely. They come out in sets of 2.
Okay. Do you offer any type of disability? What happens? What happens if I get hurt on a job?
Yes, that's a good question. And I think I mentioned it in the slide. It's a benefit we know that not a lot of carpenters are aware of. We do offer, it's a short-term disability benefit through the fund office. It's a maximum of 2 years, but it does credit the 30 hours to health and welfare, credit 30 hours to the pension fund. And if you're hurt on the job, not too different, but same thing. Call the fund office, apply for it. In that case, you're going to go to your work comp benefit as opposed to just strictly through the fund. But you still want to call us within 30 days. You do have to apply within that time frame. When in doubt, call the fund office. Like I mentioned during the slide, better to call us and let us know. If you end up not needing the benefit, no big deal, but you don't want to wait too long and then have to try to do that retroactively.
Okay. Is there any help through the fund for us to learn how to manage the money in the savings plan?
I'll take that one. That's a good question. As far as the savings plan fund goes, as I mentioned, it's considered a participant-directed fund, meaning you have control on where that money's invested, and there's 15 different investment options for you to choose from. The Newport website has a lot of educational tools and some videos on there to help you kind of navigate that information. We, as the fund office, are not allowed to recommend or advise you on which mutual fund you should put your money into. That's strictly has to fall on your shoulders for you doing your own research. A lot of our members will rely on an outside financial advisor to help them navigate through that. Some people have a family member, they have a friend that they might use. I would suggest go in that avenue, but if not, again, I mentioned if you're savvy enough that you can navigate through it on your own, the Newport website does have a lot of educational tools on there to help you get through that.
Okay, thank you, Joe. How do you see more of your work history hours? On the website, it only goes back to June. I can't check my hours before that. And if there is a discrepancy in my hours, where do you find that from again? The form.
Sure. So on the My Profile, when you log in, that main screen will only show a certain amount of hours, certain amount of entries. You just have to keep scrolling, and below that you'll see a little blue bar, and it says View My Work History. Click on that, and that'll expand out to your entire work history. You'll see multiple pages, 1, 2, 3, 4, 5, however high it goes. If there's a discrepancy, also right there on that homepage, there's an option to report a request to review work hours, and you would just fill out where you worked, how many hours you worked, and submit that right through the My Profile. That'll go to the fund office, and we'll follow up with you. You can also attach pay stubs or copies of pay stubs right there. If you're ever having any trouble along those lines, please reach out to the benefit funds any weekday, 8 to 4:30, and we'd love to track those hours down for you and be of assistance.
Awesome. Where can I find the form that needs to be submitted by April 1st?
The COB form, like Dave said, it's best to make sure you know where that is because it will put your vacation check on hold. The easiest way, you don't necessarily need that paper form. Right in the middle of the website, you'll see the 2020 COB. Click on that one and do it online is really the best way to do it. But if you prefer to do it on paper, there is under the download feature, you can find the paper copy, fill it out and mail it back. Or same as we've been saying, call the fund office and we'll put one in the mail for you.
Is there an employee contribution for benefits?
There is not. The full employer contribution, hopefully I'm answering your question correctly if I understand it, is that the full employer contribution fully is paid by the employer directly. And again, that comes to the fund office and we distribute that to your healthcare, your retirement, your miscellaneous union dues. But as far as anything being deducted from your paycheck for your benefits, it's 100% paid by the employer.
There are checkoff dues though, so if you see checkoff dues coming out of your paycheck, that is appropriate, and that's collected by your employer and then paid to the funds by your employer, collected from you and then paid by your employer to the funds. So you will see things deducted, but those aren't your benefits, those are checkoff dues.
Okay. Is there any paperwork that I have to turn into the benefit office after being inducted into the union?
Yeah, I might take that one. So I mentioned the initial eligibility packet, not necessarily after you've been inducted into the union, but at least when you earn eligibility, the COB form has to come back to us. And then if you're enrolling a spouse or kids, either when you're first eligible or as you move along, use that COB form really as the number one way to let the fund office know your address, email address, so you stay up to date with the newsletter, and then to get your kids, your spouse enrolled.
Okay. Patient First says members are yearly and dependents are every other year. Has it changed?
So yeah, and I'm not sure where it says that. If it does say it on the website, I'll make sure that gets corrected in the morning. But really, the physical for anyone 16 to 40, that's member, spouse, or dependents, it's once every other year. Once you hit age 40, it's every year. And like I said, that's really for member, spouse, or dependent. So we'll check if it does say that it's different for the member versus the dependents. We'll get that corrected on the site.
Okay, another Patient First question. I did the Patient First physical and never received a gift card.
That's primarily because we haven't sent them yet, but we just actually, good timing. We ran the report this morning for anyone that's gone since July 1st. So we're hoping to get those gift cards out to everybody. Thank you for doing it, by the way. We're hoping to get those out in the mail within the next, let's say, 10 to 14 days.
Do we personally put money into our savings plan?
You do not. Just going back to the earlier question, all of the retirement accounts are funded solely on employer contributions. Nothing comes out of your paycheck and goes to the savings plan, nor are you allowed to do that. Everything has to be 100% from the employer.
Okay, so that kind of answers the next question. Is the money taken weekly from my pay and added to the card, the HRA card? Is this also considered a savings account?
So is it considered a savings account? Not necessarily in the same way that it would be an investment account like on the pension side, but it's not a use it or lose it like a flex savings or a health savings account. This one does roll over year to year. So if you don't touch it, it's sort of like a savings account for retirement plans. When it comes out weekly, we do make 2 monthly transfers, typically around the 18th of the month and the 3rd of the month. So as you're seeing it come out, you see the hours come into the collections department. you should see that hit your HRA account and the card slightly thereafter.
And
And-
just,
Yeah, just to clarify, the HRA contribution is included in the fringe benefit package. It does not get deducted from your pay.
Okay, Mike, I think you answered this question, but I'll ask it. Is the money in the HRA use or lose or capped, or does it accrue indefinitely?
Yeah, so it'll just continue to accrue. And really, and we tell people all the time, if you have receipts that you've paid for and you don't have enough money in the account, so it's not use it or lose it, and it's not capped as the money that can be in there. It's also not capped in terms of receipts you can put in. So you get 1 year from the date of service, not necessarily the date you paid. 1 year from the date of service to turn it into the HRA. So even if you only have $100, let's say, and you get a bill for $500, send it in so it's on file. There's no harm in having receipts on file that need to be paid out to you as those contributions from your employer come in. So turn that in. It's not capped either way.
Okay, another HRA question. Where can I go to see HRA eligible expenses?
You can go to carpenters.fund, the official IRS document. I think it's document number 502 is out there. It's an IRS document, so it's a little difficult to read. What we always encourage people is the website is hsastore.com, hsastore.com. It'll give you the list of eligible expenses. And the nice thing about that is because it's IRS governed, there are certain things that you can just use, no questions asked. There are certain things that either need a prescription from a doctor or a doctor's letter explaining why you're getting it. Baby formula is a good example. It would need to be for the treatment of a condition. That website will tell you if we need those certain things to be able to approve that expense.
Catching COVID at a job site, how do we go about getting those hours missed while on quarantine?
I think this is a combination of a collections question and a medical question. If you actually get COVID, the employer will pay you your wages. However, sometimes they will not pay your benefits. They don't have to. Sometimes they will, but sometimes they do not. However, if you do actually have COVID, you may be eligible for the disability benefit, and Mike could get into that.
Yeah, so if just the job site were shut down, let's say, and you were quarantined, unfortunately, if you're not, well, I guess fortunately or unfortunately, if you don't have COVID itself, you wouldn't be eligible for disability. But if you truly contracted the virus, there is an 8-day waiting period with our disability benefit. But you figure, let's say you're out 14 days at minimum. Let's hope if you got it, you're beating it as quick as you can. If you're out for those 14 days, you can still apply for that other 6 days, get 1 week pay from us, and you'll get those 30 hours.
How do I find help in mental health problems? Is therapy covered?
Yeah, is therapy amongst everything really under the mental health or behavioral health umbrella. So anxiety, depression, we know those are on the rise. Substance use disorder. So if you have an issue with alcohol or opiates, I mentioned the company MHC because of how nuanced and how specialized that area of care is. It doesn't go through independent administrators. It goes through mental health consultants. You can give them a call. It's a 215 number. It's listed on our website. Call them, make sure that you know who you can go to. And if you do have questions, types of therapies that are covered, who might be best, give them a call too. They're experts in it. They'll be able to help you out.
Is there any way we could see these slides after the presentation?
Yes, actually, after the presentation is complete tonight, I believe you'll get a copy of the whole entire presentation that Cassie and Nicole will be sending out to anybody who registered for tonight's webinar.
Can I add to that too, that the whole thing is being recorded?
Yep.
So if you have questions or if you know somebody who could benefit from watching it, it'll be out on our YouTube channel by the end of the week.
Okay. That looks like all the questions we have tonight. Again, if we didn't get to your question, it might have contained some personal information and somebody from the fund office will contact you. Just like they just mentioned, it'll be recorded and uploaded to our YouTube channel and emailed to you. So be sure to check out carpenters.fund, our YouTube, just search Carpenters Benefit Funds of Philadelphia. Everything will also be linked in the email you'll be getting. So you can access the website, our social media accounts from there. So make sure to subscribe to our YouTube channel. And I hope this was informative to you guys. Have a good night.
Thank you. Good night.